It is a new facility that embraces an old Chinese tradition called Alma Care. It's the only postnatal retreat in Canada, and it first opened its first location recently in Toronto. It offers what you're seeing here, services for mothers that include round-the-clock care, rooms with bassinets, breastfeeding pillows, and much more. There's a massage table there. Also joining me now is co-founder Anne-Marie Mediwake. Welcome.
Hi, thank you so much for having me.
So these kinds of retreats are new to us here in Canada. You know, that we were just discussing. There's ones in the US, in New York, and other cities, but they're very popular in places like China and in Singapore. So what was the reason you decided to open one here in Canada? Why here?
So I have a Singaporean mother, and I actually had the opportunity to sit the month, which is the ancient Chinese tradition, whereby mothers, really focus on recovery 30 to 40 days post-birth. There's focus on nutrition, on staying warm, and really the internal recovery supporting lactation. So being able to experience that and see that there was a gap in postpartum care. 30 years ago, mothers stayed in the hospital for 7 days. Now, it's 24, maybe 48 hours. So really highlighted for me that there is a gap in postpartum care here in Canada. So Alma Care was opened to offer families an option for different ways to support them after they give birth.
I agree with you 100%. There is a real gap in postpartum public health care here in this country. This is a private facility, so there is a cost involved to it, and it's a high one, right? It's not going to be accessible for everybody. I mean, your website, I think, lists it at $850 a night for the sort of the sitting the month care. What does that include for clients?
So that includes 24/7 care from our expert team of doulas, PSWs, nurses, lactation consultants, postpartum supplies, all the necessities, pads, underwear, cooling sprays, things families might not know they need, like a sitz bath, and then things that aren't accessible to have at home, like we have access to a Medela Symphony hospital-grade breast pump, as well as supplies for baby, diapers, wipes, linens, assortments of creams, all the gear that you mentioned, bassinet, nursing pillow, loungers, 3 nutritious meals a day, which include snacks, broths, teas to support internal recovery and lactation. And as well, we put a big focus on education. So daily workshops to kind of help cover all the things that you need to know in those newborn early days.
Listening to all those services provided, I'm like, man, that'd be nice. But this is a private facility, but you can't help but wonder, like, that is a real need in our public healthcare system. I mean, you had a child here in Canada, you know what was there and what wasn't.
Yeah, no, definitely. I think we can go hand in hand with the public healthcare system.
Yeah.
I think that having these services available, it just gives people options. Yeah. And at the base of it, we also offer at-home care as well, which, is a little bit more, more accessible. And then also we believe that education is the first layer of support. So we have a lot of free resources, again, leveraging our team. We have advisors that are physicians. Our director of care is a registered nurse of 25 years in labor and delivery. As I mentioned, the doulas, the PSWs, the PNSWs, the lactation consultants. So really putting together free resources that families can go to and have a reputable source of information to know what to expect in the postpartum period.
There's a lot of places other than Canada we can look to on how they're doing postpartum care right. Even in the UK, which has a similar public health care system to us, they offer mandatory 6 months postpartum care for mothers where they come to you, so you're not schlepping everybody on a bus or public transit trying to get to the appointments. What's your favorite thing about this tradition? What did it do for you as a mom?
So I think it really empowered me to focus on myself. I think throughout pregnancy, there's a lot of focus put on the mother. You have to take care of yourself. You have to do this. You don't eat that. And then the baby comes and you're kind of forgotten.
And we don't live around family anymore.
No, exactly. We don't live in generational homes, so there's less support. And so I think in the postpartum period, there can be a lot of loneliness, a lot of uncertainty, and it can be very overwhelming. And what I found in my postpartum period is I felt very supported. I felt that I had permission, to ask for help, to ask for support. And I think that that's kind of gone through me, carried on in motherhood, where I take care of myself still. I'm not the last on the totem pole because I know I need to take care of myself in order to take care of my children.
Yeah, doulas will always tell you, mom first, baby will be well. Mom's well, baby is well.
Exactly, and that's really the ethos that we have. We really want to put the focus back on the mother. you know, kind of change the script of the conversation that's happening in North America of not, you know, not bouncing back, not getting back on your feet. It's focusing on that rest and that recovery so that you can, you know, take care of your newborn and be your best self for your newborn.
Hannah, thanks for coming in today.
Thanks so much for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.